those were a really good introduction. So I'm actually going to talk about a real case that I saw. I guess it's already labeled, so you guys know the diagnosis. But basically I saw a let's say like an 18-year-old female who came into the emerge with really unspecific symptoms. Like she had some changes in her vision, like right eye was like a bit blurry. She had a headache, had like a bit of chest pain, and she noticed some rashes on her body, which it was like super weird. She, I think, was from somewhere in Asia, like China, and had like recently come to Canada. She was like an international student. No drinking, no drugs, like no smoking. And she really just didn't know how these things came on. When we did the physical exam, we noted that she has like these rashes on her like hands, on the palms of her hands and like fingers. And also when we did her cardiorespiratory exam, like listened to her heart, she had a new murmur. And if you guys don't know what a murmur is, it's when your heart valves aren't working, because your heart has 4 valves, and when they're not working properly or there's like something wrong with them, the way that blood flows through them can cause can like it can cause turbulence essentially, and it causes this thing that when you actually listen to the heart you can hear it. And she had a new murmur, and she didn't really have any cardiac issues that she knew of. So these were all like very weird symptoms. She also had a fever, and we at the beginning didn't really know what it was. But after a bit of investigations like blood work, a CAT scan and things like that, we actually found out that she had like an endocarditis. And I think if you go to the next slide, I can explain what it is. If I'm not wrong. No, never mind. Oh, wait, go to the next slide. Sorry. Oh yeah, there. So we'll kind of go back to those pictures, but essentially what endocarditis is an inflammation of the lining of the heart. So it's essentially like an infection that you can pick up from different things. Like some people can pick it up from like a dental procedure, or if you, a lot of people, not a lot of people, but if you use like IV drugs, that can introduce infection through your vein, which can then spread to your heart. If you have like a new surgery, especially like a heart valve surgery, or if your heart is already prone to it, especially if you're born with like a congenital heart issue, then you're at more of a risk to get these kind of infections. So unfortunately, that's what she had. And I think at the end, because especially in the emerge, we don't really get to follow patients. So I don't really know what was the underlying cause, but it definitely wasn't drugs or anything like that. So she somehow picked up this infection that spread through her heart. And it essentially, what happens is that it enters your bloodstream and it goes to your heart. It usually vegetates a lot one of the valves, so it causes like damage to one of the valves, which then also causes obviously systemic issues. So what we think she had, and what happens essentially is like when your valve is not working properly and blood isn't pumping through your body properly, you can start to have blood clots. And what we think happened with her with the like eye problems is that there's probably like a bit of damage to how much blood her eye was getting. But you can, like as listed on this slide, you can kind of see there can be small bleeding areas in different areas of your body. So there can be some under your nail, and they're called splinter hemorrhages. So that's like on the top left, and those are like very like non-specific, but those can happen. You can have like painless skin spots on the palm and soles of your hands, and they're called Janeway lesions, and painful nodes in the pad of your fingers, and those are Osler's nodes. Yeah, so these are kind of the two kind of lesions that you can get. They're a little bit non-specific and hard to see, but obviously if you have these and some of these other symptoms, then that's concerning for an endocarditis. It's a very rare thing to have, and I don't think like I haven't really seen much of it, so it's not something to like worry about. Or if you see something on the palms of your hands, you shouldn't be like freaking out that you have something like this. But when you put it in like constellation of so many of the other things, like a new murmur, like an eye issue and things like that, then you can be sure that like that then you kind of put it together, and that's like the underlying diagnosis. The way that you treat it is actually with like 6 to 8 weeks of IV antibiotics. And obviously you get admitted to the hospital. If there's like an underlying reason like IV drug use or you know, some sort of an exposure that you can omit, you can do that. But otherwise it's really IV drugs, IV antibiotics that you can use. So I guess sorry, 1 second. You guys hear me? Yeah. Okay, good. Put my AirPods in, sorry. So another thing is liver disease. So liver disease is like an umbrella term for a few like infections and different diseases that you can get with your liver. Some of them that I'm sure a lot of us have heard is like hepatitis. So hepatitis A, B, C, and those are some of the ones that you actually get vaccinated against as a kid. And then for people who like drink chronically, you can have something called fatty alcoholic disease, liver disease. Cirrhosis is when your liver is so damaged that it gets scarred. And for people who don't drink, you can also have like non-alcoholic fatty liver disease. So those are usually people who it's like more associated with lifestyle. So if you're not like exercising a lot and eating really bad for like years and years and years, then you can have something like that. So some of the symptoms of liver disease is like swelling of the hands and feet, which is called edema. You can have like a different colored urine, especially like brown, and that's from bilirubin, which somebody has already presented. So bilirubin can like cause yellowing of or make your urine brown, and also it can cause yellowing of the skin, so it's called jaundice. And then some non-specific symptoms like abdo pain, nausea, and vomiting. Another thing that you can get, and these are again very non-specific symptoms, and like I honestly have never seen these, but your pancreas, which someone already presented, can get inflamed. So you can get something called pancreatitis. Anytime you add like an itis at the end of anything, it's like an inflammation of. So pancreatitis is like inflammation of your pancreas. And that can happen. Like you can get pancreatitis really from like anything, but like heavy drinking, a gallstone, and a mass is like some of the biggest reasons why your pancreas can get inflamed. And at kind of the end stage, when for someone who I guess has gone really untreated, because your pancreas, where they sit in your body, is actually like at the back. So if you think of like your upper back, like under your ribs, that's where your pancreas is sitting. So you can get something called like gray Turners, which is like the bruising at the back, and then Cullen is like around your belly button. So those are some of the skin conditions that you can get with pancreatitis. They're very rare. And you're just treated with IV fluids. Yeah, so something like that, but this is very much like an end stage person. Like I haven't really seen this, but possible. Yeah, so we just talked about this. Some other skin conditions that you can get. So neurofibromatosis is actually like, these are like a series of conditions where you get formation of these like benign, like meaning non-cancerous tumors that can affect the different parts of your areas. Essentially like NF1 and NF2 is just like, it's essentially like the constellation. So I don't remember the specifics, but like some affects like some organs and some affects the other ones. And then schwannomas affect they're like brain tumors on your brain. And then so some of the skin conditions that you can get with those is like the café au lait spots, which is at the very bottom. And then those like tumors that the pictures are on top that you can get all over your body. Actually, they're not dangerous, but they're uncomfortable. And then I think lastly, like it's like scarlet fever. So this is very common in kids and not very common in adults. It's a group A strep. So essentially, I don't know if you guys have had strep. It's like very common. You can get like a sore throat and you get those gross white spots, and like you go to the doctor and like that's strep. So a strep is caused by a group A strep bacteria that can cause that can cause like different constellation of symptoms. So one of them is like scarlet fever. It's contagious, and it is like strep throat. It could lead to complications, but with the development of antibiotics, it's actually very treatable, and you just like treat the patient. And amoxicillin, which I'm sure like a lot of you have already had. And the rash that you get with this is like a sandpaper-like rash. So patients come in like the one that's shown in this picture. And also if you look at their tongue, they're gonna have something like called the strawberry tongue. And it's like a very rough kind of feeling of a rash. And it's very common in kids, and it's just treated with antibiotics.
We can go to the question section. If anyone has any questions, you can feel free to unmute yourself and ask.
I have a question. So you mentioned that your